Hi, my name is Jessica Dixon. I'm a nursing student here at South Alabama, and today I will be performing the essential line dressing change checkoff. So the first thing I would want to do is I would want to verify the order and hospital policy. So I'm going to do that. Once I have done that, I'm going to gather my equipment. I have it all gathered today, so I'm going to perform hand hygiene. So now I would want to verify my patient using two identifiers. So Jaguar J. Jones, date of birth 8/25/1963, 8/25/1963. For allergies, it says he's allergic to penicillin, and penicillin is on the wristband as well. I would want to ask my patient if they had any other allergies not listed, and then I would want to explain the procedure to the patient and provide them with privacy. So next I would want to assess the site. I want to palpate over the dressing. And the next thing I want to do is I would want to get the bedside table and bring it around and put it closest to the central line on that side. I would want to make sure that it was at waist level. I would want to make sure that I put all my equipment on a flat and clean surface and position the trash can and perform hand hygiene. So the next thing I would want to do is I would want to raise the bed to a working height. I would lower the side rail. I would make sure that the patient is positioned comfortably, and I would make sure that the patient's head is slightly elevated. So the next thing I want to do is I would want to get my kit. I'm going to remove it from the wrapper, and I would place this on the bedside table at waist height so it wouldn't be considered contamination. So I'm going to open only the first side, flap away from me. So now I'm going to put on my mask. I'm going to also put on my goggles. And now I would put on a mask. I would assist my patient to put on a mask, but there's already a mask on my box. So now I'm going to put on my clean gloves. And now, while securing the catheter, I'm going to remove this old dressing. So I'm going to secure the catheter, and when I remove my dressing, I'm going to be making sure that I pull the dressing towards the insertion site. So once that is done, I'm going to dispose of the dressing. And then I'm going to assess the catheter, the insertion site, and the surrounding skin. This time I'm not going to touch though. So I would be looking for signs and symptoms of complications, and I would need to obtain a culture if indicated. This would be if I see any erythema, edema, or purulent drainage. So now the next thing I want to do is I want to remove my clean gloves, dispose of those, and I want to perform hand hygiene. So now I want to finish opening my kit. So those flaps, and then last one towards me. So now I'm going to apply my sterile gloves. So I would normally do this on the bedside table as well, but today I'm just going to do it right here. I'll dispose of that. This would be at waist level on the bedside table. So I didn't get it in all the way, but I'll fix that in a minute. Okay, so now I'm going to fix my glove now that I have them on, but not fix the cuff. So now that I have my gloves on, I'm going to arrange my items onto my sterile fill. Making sure I stay within the 1-inch border. So now I want to, first I want to cleanse the site, per hospital policy. So the first thing I want to do is I want to use my alcohol swabs. So I'm going to remove and dispose of that. The next thing I'm going to do is make sure that I maintain circular movements, and I'm going to make sure that I don't go over any area twice. I'm going to start from inward to outward. So I'm going to do this. I'm going to do this until the surrounding area is clean. So now once that is done, I'm going to keep my hands above waist level and dispose of that. So the next thing I'm going to do is I'm going to use my Chloro Prep swab, and I'm going to activate it by squeezing, and it should click whenever it's activated. So this time when I cleanse, I'm going to be doing this for 30 seconds. I'm going to be doing this from side to side, up and down, horizontal, vertical, in all kinds of directions. So I'm going to do the site and the catheter as well. Okay, so once that is clean, I will dispose of that, and I would wait until it's completely dry. Once it is completely dry, the next thing that I'm going to do is I'm going to get the BioPatch, and I'm going to put it on per hospital policy. So I'm going to put it on. Once I have it on, I'm going to go back down. I'm going to put my transparent dressing on. So I know this hand is contaminated, so I'm going to make sure that I only touch the edges. I'm going to remove the film and dispose of that above waist level. So now I'm going to apply this and make sure that the insertion site is in the middle of the dressing. So once it is on, I'm going to smooth it out. And then I'm going to remove this, and I'm going to follow it with my finger and make sure that it's adhered completely. So once that is done, I will keep this because I'm going to be using this for labeling in a second. I would not go below my waist. Well, the sterile procedure is over. But the next thing that I would do is I would want to remove my gloves. Make sure I'm going down. Dispose of those. And now I'm going to want to remove my mask. And I would dispose of that. And then I would remove my patient's mask as well, but it is taped to my box today. So the next thing I'm going to do is I'm going to raise the side rail, lower the bed. I'm going to position the patient in a comfortable position, and then I'm going to make sure that the call light is available for my patient. The next thing I'm going to do is I'm going to gather my equipment and dispose of that. And then I'm going to perform hand hygiene. I'm sorry, I did miss one part. So I would do the label. So for the label, I would want to put the date, the time, as well as my initials. I would take that off. I'll dispose of that. And then I would place this on the edge of the dressing. I would make sure that it did not go over the insertion site. So the next thing that I would do is gather my equipment, dispose of that, perform hand hygiene. So now I would do documentation. For documentation, I would do the site appearance. I would do if there was drainage and the characteristics, amount, and whether or not a culture was obtained. And if I would also document the types of cleansers that I use, as well as the type of dressing that I applied, as well as the patient's tolerance to the procedure, and also the date, time, and my signature. And this completes my checkoff.